Hi everyone. So this is the assignment launch for your application of vet nursing care reports. We're just going to spend a little bit of time talking through what the expectations are. As always, if you have got any questions, do email me directly, although we will also be setting up a discussion forum for you all to share your answers and questions together. So first thing to look at then is the learning outcomes. As you can see from the slide, this assignment does actually cover 4 of the main learning outcomes. The nice thing for that means that the exam is actually only learning outcome 2 and 3, so it does condense the exam quite significantly. So just to kind of go through the terms, just to make sure we're all happy, learning outcome 1 requires you to discuss etiology, pathogenesis, progression and treatment of disease. And what we're looking for this assignment is a discussion of infectious and non-infectious diseases, and we'll come on to what we're looking for in a second. So etiology, for those of you that aren't sure, is basically the cause or the causative agent. Pathogenesis is how it develops within the body, so we're thinking about clinical signs here, any kind of symptoms of disease. Progression is how the disease develops, and then obviously treatment is treatment. Learning outcome 4, we're looking at disease surveillance protocols. So this is based specifically in the infectious disease, and we're asking you to look at epidemiological principles, which we'll come on to in a minute, with reference to One Health, which we'll also come back to, focusing on client education and preventative healthcare. Learning outcome 5 requires you to construct a care plan for a range of cases adopting a holistic nursing strategy, and learning outcome 6 requires you to discuss the value and application of evidence-based nursing. So let's have a look at the actual assignment, because hopefully it will show quite clearly where these learning outcomes are going to be achieved. So first of all, this assignment is a report, so do bear that in mind when you're presenting your work. Think about how you can use titles and subheadings, how you might like to use annotated diagrams, tables, figures, whatever that might be. You very much have the liberty of those elements, so you can use them as you wish. But just bear in mind, if you are including a table or a diagram, we do expect these to be summarising in content, and certainly shouldn't be used as an opportunity to get more words in than your word count allows for. So just bear that in mind. So what I'd like you to do is write a report which evaluates the holistic nursing required by one patient suffering from an infectious disease and then one patient suffering from a non-infectious disease. So just to remind you, when we refer to holistic nursing, we're thinking about how the patient can be supported and cared for in order to meet its physical needs, and often the needs that are presented to it from the disease it's suffering from, but equally, how do we support the patient mentally, how do we support them socially, psychologically. If you want a reminder of what holistic nursing is, or to go back over the terms, do please revisit the first lecture from this programme, which can be found on Ledge. Just gives you a few ideas, and as always, email if you have any questions. So what I'd like you to do is to select an example of each from the assignment brief. So as you can see here from our list, these are the options available to you. So it's one of each of these. Just to say from the start, you will not be given extra credit if you pick a particularly complicated disease process, because what we're looking for is how well you describe and how well you discuss the nursing intervention that is suitable for this patient. So I would strongly encourage you to pick a disease that you are familiar with, or a disease that you are happy to research, rather than making yourselves stressed or making things more complicated for yourself by picking something that there's less research on. What I have done intentionally, though, is given a variety of diseases which can affect a number of different species. So those of you that want to do an exotic species or a non-companion species are more than welcome to. So just to go through the diseases that are available, you've got parvovirus, which hopefully you are aware affects dogs. Leptospirosis, which would be in dogs as well. Rabies can affect dogs and cats. Feline calicivirus, it's kind of in the name, but this affects cats only. Viral hemorrhagic disease affects rabbits, and psittacosis affects birds. And then for our non-infectious diseases, hypothyroidism is generally something we consider in cats. Diabetes mellitus can happen in lots of different species, so there's lots of choice there for you. Equally, arthritis can affect a wide range of species, so you've got a huge amount of choice there as well. As for chronic renal disease, we tend to consider this within cats specifically, whereas hyperadrenocorticism tends to affect dogs and cats, but particularly dogs, but it can also affect things like ferrets and horses, so that does allow for more kind of species difference there if you would like to do so. And hypertrophic cardiomyopathy tends to affect dogs predominantly, but again we do see it in cats. So as you can see, there's a whole range of diseases to pick, and as I said before, you pick one of the infectious and one of the non-infectious, but do try and pick something that first of all is of interest, but also something that you feel quite comfortable explaining. As I said before, extra credit will not be given if you pick a more rare disease, because what we're looking for is that the way in which you describe the disease and evaluate the nursing required. So for each of the diseases, you are expected to include the following sections. So I would expect to see these as separate sections with appropriate subheadings. So the first is the etiology and causative agent. So thinking about, is it a bacterial infection? Is it a viral infection? And at this stage, at level 5, I would expect you to provide a suitable amount of detail. So for example, rather than just saying parvovirus is caused by parvovirus, please try and include some more detail. So what type of bacteria is it? So what type of virus is it? How does it form? Where does it come from? Those kind of things. Then we're looking at clinical signs and pathogenesis. So initially identifying the clinical signs that you would see. But in terms of pathogenesis, again, we're looking at potentially how the disease spreads, how that spread of disease results in the pathology that we see. And again, for those of you that are wanting to hit the much higher levels in this report, we would be expecting more of a discussion around how the disease manipulates the systems, how it changes, how it actually causes and promotes the clinical signs that we see. The next section then is disease progression, so talking really about how the disease develops and causes the animal to be significantly unwell, and in this area we'd also consider diagnostic approaches. Now, one of the things that I'm looking for within your report and within your care plan is an understanding of the disease itself. So you may wish to include regular diagnostic testing within your care plan, but I'll come on to that in a minute. And then finally, treatment. So treatment, obviously there are several ways to treat different diseases, and within the treatment element, again at level 5, I would expect you to have done the research to find out what the proposed treatment methods are currently. So instead of just saying fluid therapy, please do find out, what type of fluids are recommended, what rate of fluids is recommended. I'm obviously not expecting you to diagnose at all in this report, but certainly if you do the research, the treatment recommendations are available, and you should be able to provide that level of detail. Equally, if you're describing medications, please do identify the specific medications that are recommended, and if appropriate, you can include a dose amount as well. Okay, so the other thing that I'd like you to do, once you've selected your infectious and non-infectious diseases, is we do need you to consider, for your infectious disease only, the epidemiological principle of that disease. Now, just to summarise, just as a reminder, epidemiology is the study of disease, and we will have a lesson on epidemiology in the next couple of weeks. But really what we're looking at here is showing an understanding of how the disease spreads, potentially what factors influence that disease spread. So is it predominantly found in a particular population? Are there certain environmental conditions that promote the disease to be spreading? Is it that it's close contact? Is it more that it's a disease that is non-communicable, so cannot be spread? Okay, how does that then develop in an animal? As well as looking at age and breed and those kind of things. So there's a wealth of things that you might want to look at. You may want to look at things like incubation period. So an animal that has a very short incubation period, how does that affect disease transmission? Equally, something like rabies that has a very high or slightly higher level, higher period of incubation period, how does that influence disease spread? Is it easy to trace? Is it easy to manage? Those kind of things. We also want you to look at One Health initiatives within the UK. Basically what One Health is it's where diseases have a significant impact across a number of different populations or in a number of different areas. So predominantly for us, it's where it has an influence in human health, animal health and the environment. Unfortunately, the BVNA produced a report in 2019 which goes into a lot of detail around certain things that we as a profession are trying to do to promote One Health. So I would strongly encourage you to have a look at this. I will put it underneath the assignment brief on your ledge page, so please do have a look. There's a number of different examples in there that you might want to consider based on your chosen disease, but do make sure it's relevant. So for example, one of the things within the report that's discussed is antibiotic resistance, which is obviously a concern if your disease is treated with antibiotics. However, if it's not, then it would be an unsuitable discussion point. So have a look at that. As I say, any questions, do email me. So the next big section of this report is you are required to present nursing care plans for both of your patients. Just to say at the very beginning, these are not included in your word count, so do not feel that you are limited to what you can present. But for your nursing care plans, it's generally recommended that you consider your patients as an actual patient. So I'd strongly encourage you guys to come up with a scenario or to come up with a patient that you're going to study. The reason for this is it makes it much easier if you can have an idea of what your patient is like before you start writing your care plan. As we know, care plans include lots of details around preference and around personal requirements, and if you're trying to base it on something that doesn't exist, it can make it difficult. So try and create a hypothetical patient that you're going to base this on. So to give you an example, it might be that I choose to do hypothyroidism. So my patient is Ethel, who's a 12-year-old cat. She's had hypothyroidism for a number of years and it was previously managed with medication. She doesn't like other cats, she doesn't like being handled, she prefers tuna over chicken food, and she only urinates in sawdust. That's the kind of detail we're looking for. Just kind of create your patient scenario, and as I say, you'll generally find that it will make things much easier. In terms of your nursing care plan, you are more than welcome to use whichever model you would prefer. So just to remind you, you've got the Roper, Logan and Tierney model, you've got the Oram model and the Ability model. All three of these can be found on Ledge. There are templates available to you, but we're expecting the care plan to have enough detail in it that if someone was to actually care for your chosen patient, they would be able to know what to do. With that in mind, the information you're putting in the care plan should be relevant and should be reliable, so therefore do consider putting references in within your care plan. For example, if I'm stating Ethel's clinical parameters, her temperature, her pulse, her respiration, I would generally expect to put in there somewhere the normal ranges to demonstrate my understanding of those. So do try and research those things. For example, if I said that Ethel had a temperature of 42.6 and hadn't made comment that that was abnormal, I would be quite concerned. So just bear that in mind when you're filling in your care plan. The other thing that's required is you are expected to include recommendations for client education and preventative healthcare. Now this can go in any section that you wish to, but for example you may want to include it in your care plan itself as opposed to the report, simply because it allows you to link it together much easier. So if I had a patient, for example, that I'm studying that has parvovirus and I know that my animal is not vaccinated, one of my recommendations could be that I'm going to discuss vaccination with the client at discharge. It doesn't have to be loads and loads of sections, but where there's opportunities to discuss it, please do include it. Okay, so a couple more specifics for you. So first thing is the word limit. So we're looking at 1,500 words plus or minus 10%. As I said before, this doesn't include your care plans, so do feel free to write your care plans correctly. Don't feel that you have to summarize. We want enough detail in there so that our clients so that if it was picked up by a nursing team, it would be very clear what's required. So 1,500 words, which we're looking at about 750 per example, so that should give you more than enough words to write the report. And as we said before, from the learning outcomes, you're also required to demonstrate evidence-based nursing. Now, I know this initially sounds quite scary, but basically what we want you to be able to do is when you're discussing your treatment, your diagnosis, for example, looking at research surrounding the particular disease that you're covering, and pulling out the current recommendations. Now, the key thing here is it does need to be current. So I'd strongly encourage you to focus initially on current academic journal references as opposed to books and websites. You can, of course, use books and websites, but I would suggest you use these to complement the other content. Also, quite a nice thing to do initially is to have a look at journals such as the Vet Nurse, because they do tend to provide kind of case study reports within their journal, which may well give you some ideas of the type of content. But what we're looking for is when you're discussing your patient, when you're presenting your care plans, do try and pull out those current recommendations and actually analyse what people are suggesting. As with all the other assignments, this report contributes to 50% of your overall grade for application of vet nursing, and the deadline is Sunday the 14th of November by 23:59. That's a typo, so it should be 23:59, and it's through ledge submission as per your other assignments. Now, just to be clear, I know last year each group had slightly different deadlines, but because we're doing it online this year and because I'm launching online, I have opted for you all to have the same deadline. So it's Sunday 14th of November 2021 by 23:59. So make sure you get it in on time. In terms of the grading criteria, it has changed from level 4. Again, we're using a grading criteria that's consistent across your assignments, but you might notice when you look at the grading criteria there are slightly different emphasis, and there's also a number of different areas which are less forgiving than what you would have been used to for level 4. So the first one of this is analysis and evaluation. So if we look at the grading criteria, if we look at from even just for a 40%, you are expected to demonstrate analysis and basic discussion. So whereas in previous for your level 4 it was very much more factual based, just presenting the facts, what we're looking for here is that you actually do evaluate and discuss what you are presenting. So this is where you can build in your evidence-based recommendations. We can look and see what other people are saying on the subject and actually try and kind of build your discussion around that. So for example, if I was doing hypothyroidism, I may well have found one paper that recommends a certain approach to treatment versus another one that offers a slightly different approach. So at level 5, we are expecting you to show those different areas of research and to discuss them and to weigh them up against each other. It's not just a case of identifying and presenting information. There has to be discussion, there has to be analysis. If you're unsure what we mean by analysis and evaluation, do come back to Charlotte as your year tutor. I'm sure she'd be more than happy to do a session with you, but just make sure you're clear, because unfortunately if you do not demonstrate analysis, you will fall under the 40%. The other thing that's really crucial this year, which we are much less forgiving for, is your citations and your referencing. So for those of you that struggled last year with citations, can I strongly recommend you go and use the University of Portsmouth referencing help page. I've conveniently put a link on your FDSC second year tutor page down the side on the right hand side. So do use that reference source. It's really important you present APA 7th edition accurately. And actually at level 5, if you are unable to do that, you will be capped at a 58. As you can see from the grading criteria for the 60 to 69, it says using subject convention with no errors. So therefore, assuming you do have errors, will automatically drop your grade. It's really disappointing for us as lecturers. I've had in the past some really beautiful essays on reports, but unfortunately because the referencing and the citations are full of inaccuracies, it will drop to a 58. Please don't let you be one of those people. If you are struggling with referencing, please let us know. Otherwise, you can visit the library and they can give you more support in that area. Equally, if you're struggling to use online resources, for example, you're not finding the academic journals, again, make sure you go and speak to the library or to one of the course team to get more support in that area. Don't just kind of sit back and hope it will be okay. What I would say, just to kind of encourage you, is it's not uncommon for some students to find their grades drop from level 4 to level 5 in their their first assignment. Obviously be aware you are going up a whole level, so if you are that person, please try not to be too discouraged, but do come and speak to us if you have any other questions. So just to finish up then, as I say, if you have got any questions, I am going to create a Ledge discussion, or there is a Ledge discussion forum up on the application of vet nursing care Ledge page. Please use that as your first port of call, simply because actually I'm sure a lot of you have similar questions, and if you all ask them on there, then everyone gets the benefits of those answers. Otherwise, you can email me directly and I will try and answer questions. Just bear in mind this year you're not entitled to draft reads, so do take the opportunity to ask detailed questions, because we can give guidance but we can't imply anything. So I can't tell you what to do, but I can certainly offer direction if you have got specific questions or you've got ideas of your own. Okay, as I say, any problems at all, either use the Ledge discussion forum or drop me an email, and I will see you all very soon.